average of the erosion of employer-sponsored insurance. Those points are important to remember in looking at these figures. Now yield back.
And I thank the gentleman. Thank you. I yield back.
Gentleman yields back. Under the Speaker's announced policy of January 5th, 2011, the gentleman from California, Mr. Garamendi, is recognized for 60 minutes as the designee of the minority party.
Mr. Speaker, thank you for the privilege, and for my colleagues in the Republican Doctors Caucus for a most interesting but factually incorrect 45 minutes of debate here. We're going to spend this evening talking about jobs and about the American Jobs Act and one of the great woulda, coulda, shouldas of our times. We're going to hold that for just a few moments because there are a few things that really need to be discussed from the last half hour. First of all, most of the discussion was about Medicaid. That's a program, a national program, in which the federal government pays about 50%, it varies state to state, but roughly 50% of the cost of providing medical services to the poor women, children in the states. Now, the debate was most interesting in that the argument was that there would be a lack of access, and simultaneously an argument that there were no cost control. Yet, if you were listening to our esteemed colleagues, you would have heard them say the doctors are not paid enough. I think if they're not paid enough and the doctors want to get paid more in order to provide services, then the costs are going to go up. And so the cost control argument here doesn't make a whole lot of sense. If you want to keep the cost down, you need to improve the effectiveness and efficiency of the system. And certainly certain services within the Medicaid and Medi-Cal, as we call it in California, are not paid sufficiently. Some other services are paid more than enough. So you need to balance that up over time, and all of these programs are run by the states. It's really the state that decides what the reimbursement rate is going to be. The federal government then matches the state's contribution. So the argument really didn't make a whole lot of sense. And even more so, in the Ryan Republican budget, which has passed this House twice now, there is a significant reduction in the educational services for doctors. So that the money that we, all Americans, spend to educate doctors, particularly in the that part of the program, both the basic education and then in the residency programs, the Ryan Republican budget significantly reduces the amount of money available for residency programs for family care practices, for the very basic programs that we all want to access. So for family care, for basic care, that money is reduced. And you go, wait a minute, that doesn't make any sense. If you're down here on the floor arguing that there's insufficient number of doctors and they're not paid enough, then don't argue at the same time that it's too expensive and there's no cost controls, and please don't argue that there are not enough doctors. Because, in fact, the Affordable Health Care Act expanded the number of residencies for the very basic care, for the family practice programs. So I'm not quite sure I understand what they're arguing. In addition to that, access across this nation for millions and millions of people is provided in clinics. These are the community clinics that a large population attend those community clinics for their basic services. And most of those are the Medi-Cal or Medicaid population and the very poor that are not yet enrolled in what will be the expanded Obama Cares program. So what do the Republicans offer us? The Ryan Republican budget would cut by more than a third the support for the clinics, closing thousands of clinics across this state, across the nation, and in my state, where people get access. So please do not come down here on the floor and argue for an hour or half an hour that access is being delayed when, on the one hand, you are cutting the money for access. That's what the Ryan Republican budget does. It cuts the money for access by reducing the residencies and reducing access to clinics by cutting by more than a third the money that is there to build up the clinics, the community clinics where people get care. In addition to that, I'm going to take a deep breath here. I don't want to get wound up too tight about this issue. I want to ask my colleague from New York, Mr. Paul Tonko, to talk a little bit about the Medicare portion of this.
Absolutely. You know, we didn't hear anything about what would be lost in the process of their cuts or their repeal of the Affordable Care Act. And Representative Garamendi, you're absolutely right. There is much that has been gained by the American population, health consumers across this nation, with the efforts of Affordable Care Act.